2 days later, Hope takes her drugs at 7. Soon afterwards, she feels very sick in her stomach. The drugs are causing side effects. She arranges to meet her doctor the next day and continues to take her medication. She meets with him and he switches her to a new drug. That evening at 7, she takes the drugs. She feels better. The same day, Joseph takes his drugs and has diarrhea. The next morning, when it's time to take them, he doesn't. He doesn't want to have diarrhea, and missing one dose can't hurt, right? Wrong. The HIV virus begins multiplying. This time, one of the new viruses is different than the others. It is resistant to ARVs. That night, Joseph decides he'd better take his pills after all. Most of the HIV viruses stop multiplying, except for the resistant strain. It keeps multiplying. Soon, most viruses in his body are resistant. In the next month, he becomes very sick since the resistant strain of HIV has killed most of his CD4 cells. His body cannot fight the illness. He takes his pills, but it makes no difference. A few months later, he is sicker. He must stay in bed all day. Hope, on the other hand, remains healthy. She takes her pills every day, twice a day. She continues to work and goes dancing on weekends. The HIV virus never has a chance to reproduce and develop resistance. In the meantime, Joseph lies on his bed, dying. He wonders what would have happened if he had taken his drugs properly.
I think disclosure it's important for a person who is HIV positive, because if she's taking antiretrovirals, and also if her family knows that she's positive, they will remind her of to take her medication. And if she didn't disclose to her family, she's going to hide herself, and sometimes she'll forget to take her medication, and the medication will resist.
The most scary part of my disclosure was basically being kicked out, because that's what my mother said. She said, okay, if I have HIV, she's going to kick me out. I have disclosed to my family and some of my friends. They help me to take my medication. Like, they remind me, like, say I'm sleeping, my sister will come and say, okay, it's time to wake up. She will shout, and then, okay, I'll know that, okay, it's time for medication.
When you come to the support group for the first time, there is this being tense, and you don't know if can I tell the people what's going on inside in me. But in the support group, when we are talking individually, it's when people open up. I was having this client, he never disclosed the status to her family. After being attended in the support group, he was everything for him was going very well, because the problem with him was that he was afraid talking about his status, and he was drinking, and he was depressed, and all of sort of things you can name. But after attending the group and talking with people who've got the problem similar to his, he was okay.
What I usually do with my patients is that I find ways for them I give them options, ways for them to remember to take the medications. If a person has a cell phone, we are going to send him an SMS trying to remind her that now it's time for her to take her medication, or putting her medication in a toothbrush cup, because every morning she has to wash her teeth, so she's going to remember to take her medication. And for the evening dose, she can use a pill box. She can even put it under the pillow. When she's about to get to bed, she can see the medication and drink it.
We have a pill box. If you have a pill box, it's like you don't have to go back to the whole bottles and the containers and take out from there. It's very simple because all your doses are like in one, or just like here, the way that we use. A form of a calendar. Now in the morning after you've taken a dose, you tick, and in the evening you also tick. And if you haven't ticked in the morning, it means you haven't taken it yet, because after you swallow, you have to take it out and tick.
There's this lady that I helped, and she was like coming here every day. She looks sad, she don't have money to come to hospital, and there's no food at the end of the day, and she must take this antiretrovirus. And at the end of the day she decided, why should I take these drugs on an empty stomach? I don't have anything to eat. Why? And really the doctor helped her. She sent her to Resik Street, 21 Resik Street, to get forms, and then she fills the forms. And like now she gets a grant and she's back on track. She's taking the medication correctly, and then her 2 kids are at school. The doctor check your CD4 count and all viral load, and then the doctor will refer you to Resik Street, 21 Resik Street, where you get the forms, and then you come back to your doctor, and then the doctor fill the form, and then you take back again the form immediately to Resik Street, and then they'll approve the form.
Yeah.